Dr. Anjini Joseph, Consultant Microbiologist, Lourdes Hospital, Kochi. Can you imagine a world where there is no cure for infections? Well, right now we may be feeling confident that we have lot of antimicrobials to treat infections. But what if these antimicrobial agents become ineffective? Yes, there is a chance, and it is already happening now. And antimicrobial resistance is one of the top 10 public health threats facing humanity now. Let us see what are antimicrobial agents. These are the medicines which are used to treat common infections caused by microorganisms such as bacteria, viruses, fungi, and parasites. And antimicrobial agents include antibiotics, antifungals, antivirals, and antiparasitic agents. What is antimicrobial resistance? Over the years, the microorganisms have developed the ability to evade the action of the antimicrobial agents by genetic changes such as mutation. It is actually a survival of the fittest mechanism by which they are able to flourish in adverse environmental conditions, in this case in the presence of antimicrobials. Not alone that, the microorganisms are also capable of transferring the genetic resistance determinants to other species of microorganisms, which means antimicrobial resistance can spread. Eventually, it becomes very difficult to treat even common infections, leading to spread of infection, increased severity of illness, prolonged hospital stay, increased cost of treatment, and sometimes even leading to death. What can we do to combat antimicrobial resistance? First of all, we should not take antibiotics on our own. If you are having an infection, always consult your healthcare professional or doctor who can diagnose the condition, the site of infection, and the most likely microorganism that is causing the infection, and according to these factors they will prescribe you the correct antibiotic, which you have to take in the correct prescribed dose over the prescribed duration, and always complete the course of antibiotic. As healthcare professionals, what can we do to combat antimicrobial resistance? Always use diagnostic facilities like culture and molecular diagnostics to pinpoint to the infectious cause of the disease, and so that you can select the appropriate antibiotic and taper the antibiotics accordingly. Always switch from broad spectrum to narrow spectrum antibiotics based on culture sensitivity pattern. Reserve high-end antibiotics for severe infections, differentiate between colonization and infection, and always practice appropriate infection prevention and control measures. November 18th to 24th is observed as World Antimicrobial Awareness Week all over the world. Now, this year's theme is Spread Awareness, Stop Resistance. The overall slogan of the initiative is Handle Antimicrobials with Care. This is an initiative to include all sectors for prudent and responsible use of antibiotics. The sectors including human, plant, animal, and environment sectors, and encouraging stakeholders to be AMR awareness champions. Whether you are a patient or a doctor, always remember, use antibiotics responsibly, and let us remember that small, simple actions can always make a big difference. Thank you.